Hi, this is an exercise called arch and flatten. It's going to involve a pelvic motion going forward and back. It's also going to add in a little bit of activation for your abdominal wall. So this is one way that I'll give to clients to train them to feel just their abdominal wall activating and not your lower back kicking in at all. So when you're doing this, it's a little bit of effort, should not be crazy hard, but it should be very thoughtful of where the effort is coming from. So at this point, I would have already instructed you on how to do the anterior tilt and the posterior tilt. So I'm going to skip that for this video, but there's another video explaining how to do that. So this is how to do the arch flatten. Your back already starts flat, so your back is nice and flat and even and comfortable. Your hands most of the time are going to be underneath your head. Some people don't find that comfortable, but most people do. You're going to do the breath in where the back arches. You're going to breathe out. You're going to get that posterior tilt. So right now my back is quite flat on that bed. It is suckered right down and can go nowhere. It definitely does not arch. It's rolled right back. In order to do that, I have contracted my front wall. My front wall is activated here. I keep that activation as I breathe out. I gently lift my head towards the ceiling. The only thing that's working there is this. Do not involve your hip flexors. They're not your stabilizers for your lower back. Your abdominal wall is. Focus here. So we're going to do that again. You're going to breathe in and arch. You're going to kind of relax your abdominal wall there. Now you're going to breathe out. It's going to flatten in the abdominal wall and you gently lift. Your hands are only cradling your head, so your neck doesn't have to work. This is not a neck flexor exercise. It's an abdominal wall exercise. That is what is only used. Then you come back down, you arch. You're breathing in. You're breathing out, and you're gently lifting up. You're slowly controlling down, breathing in and arching. Breathe out. Roll the belly back. Gently lift using your abdominal wall. Control down. Breathe in, arch. Breathe out. Stabilize from below and gently lift. So it's all of this doing that lift. If it's your neck, wrong. If you feel pressure to your back, wrong. If you feel tension in your hip flexors, wrong. It's only this little gentle pressure of your belly button going towards the bed that's lifting you up a little bit. So you can see how small this range is. It's not a big sit up. It's a little gentle pressure of your abdominal wall going down into the floor. And that's how you do the arch and flatten.